Good afternoon, guys. No. Um, so for this session, I will be what do you call this? Will or rather, no, I'll be discussing um, some feedbacks, no, regarding your work. So I have here, no, in this PowerPoint, some of your works. Okay, so I didn't really include everyone's work here. So what do you, ay, yan lang. Ano to? May nag-chat. Ano to? Good afternoon, sir. Brown out daw kay Kilalib. It's fine, no? So, if she can make it, no, the better. Kay, again, no, like I said prior to starting this, para at least, no, most of you guys, no, or rather all of you guys, I mean, no, can absorb some of these feedbacks, no, and in a way, no, again, strategize how you would go about writing this area of the documentation. Okay, so what was I saying? Yeah, so dito, no, in this PowerPoint, I placed here some of your works. So I believe there are at least three, no, that I've included here. So what I mean to say, no, three prognosis and three problem lists. So I didn't indicate lang, no, kung kay sino ni work, but hopefully, no, you guys can take something out of their work, the correctness, as well as the corrections mismo. Okay, so here now, let's take a look at the first prognosis. So here now, the prognosis reads, so wait lang. Okay, so this is on the second case. So it states here that patient has the capacity to be able to brisk walk and participate in garden and other nursing home activities again, since he is motivated to do so and has been treated stat by his doctor. So immediately, no. So, however, several factors outweigh his capacity and can hinder his recovery, such as his age, so weak immune system, low bone density. Okay, so implant materials that can cause infection, and patient may not be able to heal properly due to his slow immune response, making it hard for him to achieve his goal. Okay, so here's one advice, no, to you guys. When you're writing your documentation, no, in whatever area, in fact, so when you're trying to make a statement in your own words, when it comes to documentation, as much as possible, you try to make the tone, no? So bale kung ginabasa siya, so you try to make the tone of your writing informative rather than academic, if that makes some sense, no? So kumbaga, no, how you write your documentation, no, in whatever area, you have hindi mo siya kinahanglan nga sila nga daw ibutang mo da ang mga details or specific informations, no? Like, for example, I've read some, no, prognosis nga gina-state nila kung ano na nga sakit ang frozen shoulder. So, it's not that, no? Kay basically ang mga nagabasa nga ni are medical practitioners. So, kag at the same time, though hindi siya though ang tone niya bala do matyagan mo do nagsulat ikaw yasang research paper nga butangan mo da nga because frozen shoulder is a what you call this is a self-limiting condition, therefore amunia mo to, the patient will get better. Remember, guys, that even if frozen shoulder is a self-limiting condition, no, it might not be true to all patients nga within the time frame nga, I don't know, maybe 6 months makarecover si patient. It's not always true. And at the same time, you don't make it sort of like a discussion or seminar type nga statement. Okay? So, that's just one piece of advice when writing down documentations. So let's try to review this, no? The first statement. So patient has the capacity to be able to brisk walk and participate in garden activities. Okay, so it is in the tawag ni, no? It is in the judgment of the group here, no, nga pwede siya maka brisk walk liwat. So remember guys, no, in the prognosis, you're not only you don't narrow down, no. Again, you try to avoid tunnel vision when writing your prognosis. You also have to consider kung anong current situation ni patient. So, kumbaga, no, you also consider nga, what about the ROM? True enough, no, basi motivated man si patient, like very willing siya, but ang physical presentation niya may not be that promising. So, kumbaga, no, if you try to look at well, I don't have the copy right now, no, but this is just a piece of insight for you guys. You also try to look at the physical measurement ng patient. So let's say ang ROM niya basi severely impaired, or let's say ang muscle strength niya, no, significantly weakened gid. So it could be the case, no, that returning actually, no, to, for example, in this scenario, brisk walk, like normally, no, sa pagidna, perhaps you're thinking basi makabalik siya sa near normal brisk walking. So it might not be that realistic. So if it were me, no, true enough, yes, perhaps, no, the patient may be able to return to brisk walking, but because of his age, it might not be the near normal performance of the activity. So you could say, no, nga the patient may be able to return to brisk walking and participate in what do you call this, in nursing home activities with modifications. Okay, so at least you're making it sound more realistic, man, kumbaga. Okay, and by the way, guys, no, I hope you guys are taking this down, man, para in case, no, sa future may ideas kamo on what you need to be aware of, man. Okay, and so Duso has been stat treated by his doctors. Okay, so that might be acceptable, man, no. So well, actually, no, that for me that's acceptable. That considering that naagapan siya temprano, no. So means to say wala na nag-complicate ang iyang condition. Therefore, it promotes a higher chance of better recovery. So, however, several factors outweigh his capacity and can hinder his recovery. So, you try to sum this up, no. So what I can see here, no, is what you're trying to say is that because of his age, no, and implant materials, which could lead to be, which could lead to the possibility of infection. But take note, no, that hasn't happened yet. The part about the infection and implant material, plus the implant material. So though wala man actually, no, there was no mention again. Butangan siya sang any sort of plastic or metal implant. So you have to be careful, guys, that you have to be careful about being presumptuous about your statements. Okay? So, and at the same time, no, so you don't have to break everything down. Like when you mentioned here, can hinder his recovery, such as his age. So, ginbutang niyo weak immune system, low bone density and mass. So it's enough, no, nga we can understand nga because of his age, base lower ang chances niya for a better recovery. So okay lang na, no, nga you will say that however, because of the patient's age, faster recovery might not be a possibility. Okay, you can say that, but nga sila nga do i-breakdown mo gid siya, no, kay do kabudlay man magamba nga weak immune system, low bone density and mass. So very ano siya, I don't know, no, anong word. So do tamaan siya ka specific nga at the same time do ka judgmental bla nga do we don't even know if compromised or weak gid man ang iya immune system despite his age. We can never know that unless it presents sa, like for example, sa mga laboratory results. So as much as possible, when you're writing again your statements, you should avoid misleading. Okay, so that's the word. You should avoid misleading statements. Nga base questionon balasang, let's say ginpasa nyo na ni sa doctor or whatever, kung sino man da nga clinician involved sa case ng patient, pagbasa nila nga weak immune system, so meaning immunocompromised si patient. So again, you don't have any ways to justify that kay wala man siya sa gathered information, di ba? So again, avoid presumptuous and misleading statements. So you could just say no nga for his age, maybe recovery, or rather no, here's the statement na lang. However, for considering the patient's age, optimum or near normal recovery might be unrealistic. Okay, so that's just a piece of advice here. But you can say it however you want, so long as you always keep in mind, man guys, no, that your statement is also not lengthy. Hindi siya tamaan ka flowery. So you can be straight to the point, no, but at the same time, no, hindi man siya tamaan ka direct, nga do ka enumerative na lang. So you have to find some sort of compromise between a short between brevity and the length of your statement, of the idea that you are trying to express in what you're trying to write down. Okay, so implant materials again, so the medyo presumptuous kay there was no mention no in the case base may implant material. So perhaps later on, no, if you want these things to be a little bit more clear, perhaps in yung interview sa mga patients, you can be mindful of these things. Like you can ask the patient nga, so sir, ba may idea ka kung anong ginubra sa imo or anong pag-opera sa imo? So kung wala siya kabalo, then so be it, no. You never know man ya. Okay, so long as it's just within the information you've gathered, it's fine. Okay, so infection, immune response, again, immune response. So making it hard for him to achieve his goal. Okay, so again, no, these are some points that needs correction. Okay, but however, no, I can see the point naman. So the statements, I'm not saying that the your prognosis here is incorrect, no. It's just that some statements need correction. Okay? So at any point in time, no, if it seems nga hindi siya clear, or it seems nga base confusing pa, so just feel free to interject. Okay? You can just you can just chat your questions or open your mic freely. Okay? And I highly encourage it, man guys, no, because basta first time daan ng documentation, do medyo confusing. Pero over time, kung maanad ka mo sa sige-sige sulat, especially sa internship nyo, though it gets better man. Okay? So here, let's look at another prognosis. So patient has a patient has a fair prognosis in relieving pain, secondary post-op. Okay, so be mindful lang guys, no, on some grammatical errors. So I'm not too hindi gid ko paano ko ang balon. Do medyo particular ako gawa sa grammar, no, sa sentence construction. So just be careful lang. I know these are just some minor errors, but later on in the professional field, no, it might not be pleasing para sa mga other readers. But anyways, no, just my grain of salt here. So in relieving pain, secondary to post-op hip surgery, and returning to brisk walking due to uncomplicated and early surgery, as well as the absence of comorbidities. Babasa ako to what? Patient has a fair prognosis in relieving and returning. Okay, so fair prognosis. So was able to brisk walk in nursing home grounds prior to hip fracture, which is a sign of potentially fair chance of recovery. Okay, so let's just stop there for a minute now. Let's just deal with these two statements. So patient has a fair prognosis in relieving pain, secondary to, you don't have to, no. I get what you're trying to say here. So let me just correct this now, or try to make my personal nga edit dire. So you don't have to say secondary to post-op hip surgery because it's already a given in this case. So it just makes your statement a bit longer than it needs to. So you could just say patient has a fair prognosis in pain relief. So that's perhaps a better statement there. So instead of in relieving pain, you could just say pain relief. So patient has a fair prognosis in pain relief and returning to brisk walking due to uncomplicated and early surgery as well as absence of comorbidities. So I think this is a good sentence, or rather, this is a good statement. Amo lang to, instead of saying in relieving pain, you could just say pain relief, and you can omit secondary to post-op surgery because again, it's given for this case kung anong iyang current condition. And I also have the same comments about brisk walking. So if you consider his age, he might not. He might be better off nga mag-return to walking and other activities with modifications as well as precautions in the early stages of recovery. So that's one thing, pagid. So your clinical judgment, guys. So let me digress a bit. So understand, guys, that your clinical judgment also requires you to have knowledge of the condition. Okay, so medyo kot-koton yung memory bank nyo, kung makita nyong isa ka condition and how you correlate it with the patient's characteristics or the patient's situation, and what is the outcome that you will eventually predict a realistic outcome for the patient. Okay, so amo na siya, so uncomplicated surgery. So patient was able to brisk walk in a nursing home prior to, so again, this is also as I understand it, this is also a part kun nga or rather this is also a reason kun nga base pwede siya ka return sa iyang nga mga dati nga ginaobra. So let's just try and shorten this statement here. So patient was able to brisk walk. So you could just say nga pwede niyo siya isugpon actually. So let's say ang ginbutang niyo na they returning to brisk walk with modifications or whatever. So you can say comma na lang din early surgery, absence of comma naman, absence of comorbidities, and tapos sugpunan niyo and patient's prior functional history. Period. So it's understood na nga ang or whether ibutang niyo siya nga because of the patient's functional history or previous functional level, you could say nga it can contribute to a much better prognosis. Okay? So again, just to shorten this up, you could just say nga diretso nga sugpunan niyo siya absence of comorbidities and patient's prior functional level or functional history mismo. So here again, I think I have the same comment here. So however, patient is geriatric. Okay, so first off, that sounds awkward. However, patient is geriatric. Or so mo na lang here's the thing, pagid guys, when you're making these statements, try not to be although syempre wala na yung mali siya sa ginasulat. If it's true, then it's true, but pero ang advice ko lang din try not to make your statements nga though medyo judgmental, like magamba ka patient is geriatric or stroke patient. So you're putting a label on the client, which is in modern times, no, though medyo sensitive na siya kay kung i-label mo siya, though medyo stereotypical ang buwa sang statement. Okay, so let's say kung ang patient manabi no, may condition siya, it's better to say nga, instead of saying a stroke patient, you can just say a patient who experienced stroke. Also, in some cases, no, it's acceptable nga magamba kabi nga patient who suffered from stroke. Although the word suffer, no, though medyo kagrabe gid siya bino. So sometimes it's not acceptable, but for me, no, okay man lang na siya. But it depends, man. So just keep an open mind about that. But the takeaway point here, no, is try not to label your patient too much. Nga do ginhimo nyo gid siya adjective, no, ang iyang condition. Okay? So anyways, going back here, no. However, patient is a geriatric, which may contribute to delayed here reduced chances of functional capability. So again, no, you could just say that due to the patient's age, a faster recovery may not be realistic. Okay? So you don't have to label, no. You can just say ng patient's age na lang. Para kay at the same time, no, it helps make your statement not seem stereotypical. And you don't have to state this delayed healing process. Again, try to avoid being academical about your statements, okay? So regular PTR, physical therapy rehabilitation is highly encouraged to promote healing, excuse me, maintain joint, okay? So that's a good statement, man. High impact activity should be avoided. Well, we can't really expect, no, as a 72-year-old na patient ganina. Although I can understand, no, nga siguro sang bata pa siya, engaged siya sa sport. But let's also try to be realistic in our statements, no. It's apparent naman, no, nga hindi maniguro mag high impact activity si patient. So you might want to think of a better phrase than high impact activities, no? So anong pwede Driman? So by the way, guys, no, if you have any suggestions, feel free to write it. Feel free to tell me. Okay, again, like I said, there is no standard way of writing your statements, no. The goal lang gid is that ara ang main information kagara ang data nga ginapangayo naton. Okay, at any point in time, feel free to suggest. Like parehas niyo, though medyo brain fog man ako, no. So be my guest, you know. I'm very open gini siya for your personal suggestions man mismo, and we'll see if it works out. Okay? So here, no, high impact activity should be avoided during the early stages of rehabilitation. Okay. So instead of high impact activities, no, considering the patient's age, so again, it's not very realistic, no. So you also have, no, kung madumduman nyo ang tawag ni, kung madumduman nyo ang hip surgeries, no, do medyo ang ginabawal gina sila, or any form of joint surgery na lang abe, especially in the lower E. So if you can recall, guys, no, joint surgeries in the lower extremities often have precautions. So syempre kung athlete, high impact activities, contact sports, but considering sa individual ngani, mas better if ang aton panumdumon is more on the side nga mag weight bear siya. So full weight bearing activities pwede na siya, di ba? So you could say, no, nga full weight bearing activities should be avoided during the early stages of rehabilitation or until further notice by the surgeon, di ba? Okay, think about it, guys, no, for a bit, because ang surgeon ngani ang nag-operate, siya na yang may knowledge kung anong kondisyon, anong sitwasyon sang hawak sang pasyente nga na. Okay? So you could say that. Okay? Nga ano to ginambal ko? Full weight bearing activities should be restricted or should be avoided during the early stages of rehab or until further notice by the surgeon. Okay, so patient may be able to brisk walk around the garden but assistive device. Ari gali, no? You actually stated nga pwede siya makabalik sa walking. So, I don't know, no? May reference ka mo di. And again, no, you don't, like what I said, no, you don't provide your references PT prognosis because this isn't a research paper. Okay, this is a documentation. So, just be mindful, no? I don't know if this is a mistake or this was deliberate. So, amo lang na guys, just review your work, kumbaga. So, I think we can insert this, no? Sa diri na lang apart. Ang last statement nga, may be able to brisk walk around the garden but assistive device is recommended. So, you could just insert it here, no? Sa first part. Okay, you could just rewrite it nga para ang brisk walking or ang activities, no, or other activities, ara na lang siya sa first part. But at least it makes your statement man organized. Okay? So, let's move on to the next now. So, PT prognosis. So, I think this is, so amo na niyang sa frozen shoulder. So, PT has, sorry, not PT. So, the patient has good prognosis to return to work due to the early diagnosis of the condition and is self-limiting in nature. So, dara pa lang, no, let's stop there. So, like what I said earlier, no, you don't have to describe the disease unless needed. Because frozen shoulder, no, although true, it's a self-limiting condition, you can't expect all of these patients to return to their previous near normal functional level. Because again, it's always subjective. Kaya you never know. Base kung si patient ganiya, natabuan nga active lang gid man siya or ang disease progression niya isn't that bad compared to other patients or ang iban nga patients siya frozen shoulder manabe pero ilayan ginpabayan nila ya tungod kay masakit or wala sila kwarta para magpakonsulta. So amo na just make sure guys no nga you avoid these sort of statements. Always make sure nga your statements regarding the prognosis or your PT impression, kumbaga, no, isa pa gina, no, make sure that it is unique to the patient's situation and to the patient himself. Kaya you cannot overly generalize these things. So what is true for this patient might not be true for the next patient. That's why nga kung ibutang mo siya nga self-limiting in nature. So it's like you're telling the reader nga tanan nga patients with frozen shoulder will be able to recover eventually. Okay? So again, no, let's just avoid these sort of statements. So patient has good prognosis to return to work. So pwede no, acceptable man siya nga due to early diagnosis. And if you seem guys no nga you're nga do nga basi mabudlayan kamo no kung anong isugpo nyo, my strategy for this no is I try to look at the objective findings. Okay, so you don't have to limit yourself sa mga subjective lang nakita nyo sa patient, like kay tungod motivated siya, grabe support system niya, therefore mas better ang iya outcome. So you also look at the objective measurements, the physical measurements, like what I said, no. You can say here, no, the patient has good prognosis to return to work because, let's say, as I recall, no, do okay man ang muscle strength ng patient kani. So you could say, the patient has good prognosis to return to work since the surrounding musculature of the affected shoulder has not been severely affected. You can say that, okay? So again, you turn to your objective data. Okay, it might be telling you something man about the patient's prognosis. Like, for example, kung ginbutang ko to na, so wait a minute lang guys. Okay, so what was I saying? So for example, kung ang ginbutang ko to nga data sa ROM sang pasyente, no, base zero gid ya, frozen shoulder pero zero. So it could tell you nga base hindi maayo ang prognosis ni patient so lihi. So in that case, you could say nga the patient might not be able the patient returning to work maybe returning to work immediately might be unrealistic for the patient due to the fact that ROM has been severely compromised, as well as muscle strength shows poor. Liwat nakadula. Budlay kung di ko pag-isulat. What was I saying? So you could say, for example, no, immediately returning to work might not be a realistic outcome for the patient due to the fact that range of motion is severely compromised, as well as shoulder musculature is poor, has poor strength. You could say that. And that's just an example, guys, no, of using your objective findings para mahambal nga amo ni ang prognosis ni patient. So using your objective findings, your physical data or physical measurement that you've taken in order to support your judgment sa prognosis ni patient. Okay? So, yeah, you can exercise with that, guys, no? Kung nabudlayan ka mo mag-express nga low collective, try to go into specific details when making your prognosis. Okay? So here, patient, next statement, no? Patient is young and motivated to return to work, which is a potential for better recovery. So, okay. So, pwede na siya, no? Pwede niya siya isugpon. However, patient education on the slow progression of resolution and consistent PT rehab must be emphasized as the patient progresses towards the later stages of the condition. So it seems that you're saying here, no, nga there is the possibility nga base maglala. So I don't think that's or rather your aim here, no, sa prognosis is to emphasize education sa patient nga kung anong gin-experience niya is natural because of the characteristic of the disease. So it's not bad, no, nga let's say if I were to rephrase this, no, nga patient education should be emphasized. So period na lang, no. Or you can say, no, nga patient education may be emphasized regarding the progression of the condition. So that's not bad, man, no. But again, no, your aim here is remember, no, you go back, you try not to lose track kung ano ang ginasulat niyo nga area sang inyong documentation. Remember, this is the prognosis part. So what do you expect for this patient? Or what do you expect will the patient be able to accomplish later on? So you might want to rephrase this, no, into something that gives a clear picture kung ano ang outcome ni patient, ano ang prediction mo para sa patient gani later on. Okay? So, paano ito siya i-edit? So, pwede naman, no, mahambal nga ang patient education may be emphasized in order to promote, let's say, better recovery. So, you can say that, man, no. But again, no, don't worry, guys, no, if you're making similar mistakes, no, or if you've noticed nga you've made some similar statements, it's okay, no, kay I understand nga first time nyo pa man lang na day. But again, try not, ang piece of advice ko is try not to lose track kung ano na ka mga area nga nagasulat. Understand nga this is a prognosis, so the bulk of your statement should be focused on whatever the outcome of the patient will be later on. Let's say during or after rehab. Okay? So let's proceed to the next prognosis. So same in gyapon, frozen shoulder. So patient is young, which would be a potential for faster recovery and shows good prognosis to return to work. Since, again, no, 1 to 3 years, wow. Do tamaan man nakadugay para sa frozen shoulder. So I don't know what reference yun kwa, but grabe man, no. With 3 distinct phases. Again, this is very academical, no. So again, so the same comments for this sort of statement. Okay. So patient's age. So pwede ka muna kambal, no. Patient is young. Which could be okay. So I suppose that's okay now. So again, no, you don't have to focus all the time, no, sa characteristics ang condition, but you can focus, no, ang reasoning nyo kung paano nyo ma-justify ang prognosis. Again, liwaton ko lang. Hindi nyo siya pag-i-focus all the time sa nature ng disease, but try to use man ang inyong mga objective findings. Like what I said, you could have made use of the ROM and the muscle strength. Okay? Tungod okay man lang ang muscle strength ni patient, so basi okay ang iyang recovery later on. Hindi man tamaan ka nubo ang iyang range of motion, so basi pwede pa siya maka-return to near normal functional level. Okay? So however, the patient needs continuous rehab and medication to minimize the pain felt at the initial stage. Adjustment should be made in order to minimize the aggravating pain. Again, no, the statement here na patient needs continuous rehab and medication, I think that's okay man, no? Kaya hindi man siya super gid, though hindi man siya super nag-deviate sa predictor naton. So should be made, you could say, no, sa diri nga last part, so adjustment should be made in order to minimize the aggravating pain. So what this tells me, no, is that patient can perform or will, no, by the way, sa pagina, because this is an outcome, this is a predictor, try to use future tenses in case lang. Okay? So going back here, no, adjustment should be made in order to minimize the aggravating pain. So it's much better, no, because I feel like ang gusto niya i-deliver dire is that si patient pwede siya maka-ubra liwat, pero kinahanglan lang modifications or adjustments. So you can say, no, nga patient can continue activities of daily living with adjustments or modifications, okay, in order to lessen the aggravating pain, no, kag hindi man lessen, in order to prevent occurrence of symptoms. Okay, so ano tong ginambal ko? So patient can be able to, or patient can return to activities of daily living with modifications to protect the joint or or to decrease the incidence of symptom recurrence. Okay, so the rest here now, I have some similar comments man sa previous. So next is, okay, so we're at the problem list. So before I proceed, so are there any questions, no? So if you guys are still with me, so before I proceed to problem list, so are there any questions and clarifications, no? So again, guys, no, if you need things to be clear na diri, no, so I don't know if things seem confusing, so I highly encourage, no, to express what it is, no. Kay as difficult as everything is now, no, virtual classes pa kita, so it's kind of hard, no, So I urge you guys no to not just be passive about it. Okay? So not just sa akon nga mga subjects no or topics, but I encourage you guys no not to be passive about things. So if there are things no nga that you feel might be difficult, so just feel free lang gid. Okay?
Excuse me, sir.
Yes.
Try lang po for clarification ng good sir. So bali in terms like ang strategy pala in terms of being a PT prognosis, it's like though we will assume, let's say the PT has poor prognosis, diyon provide lang kami diyon reasoning namon why so. Amo lang gid mas straight to the point why so lang diyon sir. So like PT has poor prognosis with his let's say recovery isang hip fracture because di-instate namon ang subjective and objective findings daw mo na sir.
Yep. Kung i-mo unta siya no kung i-compress agad ang tawag ni ang idea of a prognosis, then yes, actually though amo lang gid na hindi ko man pag-ilang no. Amo na siya. Like, why do you think the patient will only be able to recover by this much and why? Okay? So, yeah, actually you're correct no in saying that. So, kumbaga amo nang gist sang prognosis. So, ang iba lang na din no, ang mga feedbacks nga ginahatag ko sa inyo is that there are different ways to go about it. You can look at the patient's demographics. You can look at the patient's objective data. So that includes everything no, from ROM, MMP, functional history. Functional history, current functional level, your assessments. What do they tell you about the patient's case? And what do they tell you on how the patient might be able to recover later on? Okay? So you're correct in saying that, man.
Thank you, sir. Another question, pagid sir. Let's say this, sir, the patient has multiple conditions. Will we make separate PT prognosis per condition, sir? Or i-lump up namon sa isa lang ka, let's say, paragraph?
Depende, no? What do you mean by multiple condition? Like for example, na stroke na siya, tapos may cardiac condition pagid siya, like do something daw mo na.
Daw mo na, sir. Like for example, kung motor vehicular accident, because of that damo siya, let's say fractures. Let's say mayara siya hip condition. Let's say total hip replacement. Diyon mayara pagid siya surgery sa iya shoulder and mamuno mo na, sir.
Okay. So in that case, okay. So MVA si patient kag damo-damo siya mga problema bali may na SC dugangan ta pagid bino, let's say may may incomplete SCI pagid siya, may fracture pagid siya sa kamot, may sa tiil and kun diin padara. So you have to focus your attention first and foremost gid kun nga nagkadto si patient sa imo. Is it because of the fracture sa hip? Is it because sa fracture sa ankle? Or is it because sa SCI? And usually, no, if I were to say this, kung kisa ano man siya though kung kisa very focused man ang diagnosis ni patient, usually ga-focus sila sa SCI. But I understand your point, no? So, ano gid bala ang goal namon? Will it be sa shoulder or ang attention namon, I mean? So, din gid man nabi ang attention tatuod no sa hip, sa knee, sa shoulder, sa SCI. Well, the answer there now is that in everything actually. But because ang prognosis nato no, let's just focus lang sa prognosis no because it's going to be different sa iban nga areas. When it comes to the prognosis, you consider kung ano ang goal ni patient sa ulihi. So, and at the same time, you try to predict kung ano ang outcome ang recovery ni patient in terms of physical activity or returning to whatever nga physical activity. So, yes, in a way, medyo isa-isahon mo na siya. But you should keep it within the context of physical recovery and at the same time, kung ano ang goal ni patient. Okay? So, let's say yes, may fracture siya, pero hindi nyo na siya pag isa-isahon. Hindi nyo na pag isa-isahon nga may prognosis ka para sa hip fracture, may prognosis kapag sa SCI, may prognosis kapag sa ankle ankle fracture. So, hindi na siya. Ang imo focus sa prognosis is, let's say kung matabuan, nga damo-damo problema si patient, you try to collect everything and i-consider nyo na ang kada nga condition ni patient as to how it will affect his recovery and if his or her goal is realistic. Okay? So for example, let's say you interviewed this patient with, you interviewed this patient with who experienced rather MVA. So let's say the patient told you nga, well, ang goal ko gintani is nga para maka-return to work. So given nga may mga multiple presentations siya, may SCI na siya, may hip fracture pa siya, may wasak pagid ang iyang fingers, ankle, etc. So you assess, will it be possible for this patient to return to work? So you could say, gamat-amat ka na construct as you gather data. You say nga, returning to work might be unrealistic since the patient displays due to the nature of the patient's injuries, which is nga muna may multiple fracture siya, and plus may SCI pagid siya. Okay, so kung magets niyo, though focused siya sa goal ni patient, and at the same time, let's say ang imo naman nga perspective on the patient's recovery, insert mo siya nga complete physical recovery or the patient returning to near normal level of function might be unrealistic due to blah 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 blah. Okay, you then state your reason. Pero again, sorry, dugin palawig ko to siya. But then again, hindi mo siya pag-isa-isahon. Nga may prognosis ka para sa SCI, may prognosis ka para sa hip fracture, sa ankle, etc. Okay? So I hope that's clear to you, and to everyone who might have a similar thought in mind. Okay? So, ano pa? So anyways, so again, if you guys have any questions, so just feel free to chat or open your mic. So anyways, let's proceed to your problem list, or lists rather. So let's try to look at this first. Pain on left shoulder. Okay, so this is the adhesive capsulitis. So pain on left shoulder graded 10 out of 10. Okay, so personally, I can accept this. Although it's very specific, but again, it's fine personally for me. LOM on left shoulder, flexion and vertical abduction, weakness of shoulder vertical abductors, ERIR. Okay, so be mindful lang guys, when you're kung ang gina-pertain tagan is movement like abduction, what else? Adduction, internal rotation, external rotation, it's okay to use abbreviation. But if you're referring to the muscle groups like external rotators, you have to write the whole word. Okay? Kaya different ang context, different ang gina-name mo, kumbaga. It's not the motion, it's the muscle group na. And we don't have abbreviations for muscle groups. Okay? So weakness of shoulder, okay, musculature graded 3 out of 5. Okay, so I think that's fine, man. So difficulty in raising left arm overhead. Okay, so I think the difficulty in raising left arm overhead, you can already include that no sa limitation of motions of flexion. So you don't really have to state it here. Kay though understood naman siguro no nga pagambal LOM sa shoulder tapos ginbutang mo na si abduction or si flexion and whatever. So understood na nga may difficulty siya raising the arm overhead. However, no, what's lacking here actually, and the reason nga gin butang ko to no, I think it was sa interview portion. The reason nga agin state to nga dogin include ko to si nga nabudlayan si patient mag-raise ang arm overhead is that I was hoping you guys no could deduce nga means to say no kung nabudlayan na siya magubra na activities of daily living niya ang affected. So you could say no sa problem list nga ni is that the patient has difficulty performing overhead movements or ADLs that require overhead movements. You could say that here. Okay, so again, let me say that one more time sa problem list. Okay, para ako mismo hindi man malipat. So you could say no nga patient has difficulty performing activities of daily living which requires overhead activities. Or you could just say nga patient has difficulty performing overhead activities. Okay? So I hope that's clear. Kaya ang mga pagini guys, so and I've seen this mga problem lists, you know, in general. Mag-problem list kamo gani guys, hindi niyo siya pag-enumerate lang. Okay? Nga kun ano lang ang ginhatag sa inyo nga data, dogin kopya niyo lang tagin butang sa problem list. That should not be the case, no? You have to state what it is. Like for example, kung ang isa to sa mga data no, ginhatag ko to nga ang LGM sang left niya mas dako compared sa right or baliskad lang ko but anyway, let's say ang LGM no on one side sang leg is bigger than the other side. So what does that tell you? You're not going to write it down sa problem list nga LGM is bigger on right compared to left. No. What does the increase in LGM tell you? Okay, so what does it tell you? So obviously, it could be edema, or it's most likely edema. Okay, so you could say no, instead of writing down nga LGM lang, dako sa right kag sa left, you could say patient has edema on his right leg, period. Okay, so you have to interpret the given data man is what I'm trying to say. Okay, so another thing, so let's look at a different problem list na no. Okay, so sa hip na ni. Why ko na butang ang isa pa problem list sa shoulder. But anyways, so ginbutang ko man to I think sa shoulder nga nag-decrease ang muscle tone ni deltoid. So what does that tell you? So you could say no, nga patient is displaying patient is displaying signs of hypotonicity. You don't say decrease in muscle tone. You use the appropriate term or the symptom that it is pertaining to. So it could be no, there are chances that it could be hypotonicity or it could already be signs of atrophy. So instead of saying decreased muscle tone, which is dogin describe mo lang siya, you should be able to interpret what that information means. Okay? So I hope I'm clear that no sa problem list. It's not just enumerating kung ano ang given nga data. It also includes interpreting kung ano na ang data nga na. Okay? So for example man, and this is to help you guys man later on. Kay sa matabuan no nga you're going to handle actual patients no eventually. So if you see nga let's say it's a stroke patient no, if you see that the left side no, the unaffected side has more tone on let's say the biceps compared to the affected side nga mas decrease ang tone, you're not going to say nga no, the patient has a smaller biceps compared to the other side just because you saw nga mas gamay gid man. you have to interpret what that means. Nga gamay ang biceps niya sa affected side. Is it because of weakness? Is it because of atrophy? Or and so on and so forth. Is it because of disuse? Okay, you have to you have to interpret your observed findings and other gathered information. Okay? So anyways, no, for now, syempre, no, early lang siya. First time niyo pa man ang documentation. But take it take it as constructive feedback, man. Okay? So so let's move on to another example, no. So difficulty, so I think this is sa hip na. So difficulty when changing diapers and clothes on lower E. I don't think we have to be specific about the diaper, no? Because the diaper. Sorry, wait, usap ko. What was I saying? So you don't have to be specific about the diaper part, no? Because the diaper here, ginbutang ko na siya para ma-gets nyo actually nga nagagamit si patient diaper because, what do you think? So let me throw it out there, anay, no? Para mabugtawan ng iban sa inyo. So let me just throw it out there. Why do you think, kung nagadiaper si patient, what does it tell you? As a PT, observation, what does it tell you nga nagadiaper si patient? Urinary incontinence. Pwede. So, okay, so let's stick with that, anay, no? So what does it tell you kung let's say may urinary incontinence gidman si patient? How would you try to use the ICF. What will it affect the patient? How will it affect the patient later on? So, di ba, disease, impairment, activity, and etc., so on and so forth. So, din na makaapekto si urinary incontinence, if ever nga urinary incontinence, gid man nino. Excuse me, wait lang. Impaired mobility and or sorry, what was that? Dula. Impaired mobility and or incapable of transfers. Okay, so you're close na actually. So yes, it's true because perhaps perhaps of urinary incontinence for his age, kay actually wala ko man na state, no? Or maybe it's because of the functional problem nga hindi siya ka-get out of bed. Wait, mayari pa. Problem with FIM, specifically with sphincter control. Well, again, no, it wasn't given, no, but okay, so let's just try to keep an open mind na lang, no. Let's say I accept these things, no. Incontinence, sphincter control, and difficulty to stand and ambulate. So either way, no, whatever the reason is, kung nga nagadiaper si patient, it actually tells you that the patient has a difficulty in an aspect of his ADLs, which would be, so isipon mo, no, ADEPT PC. So gadiaper siya, so means to say may difficulty siya sa personal hygiene. Okay? And it could also mean, no, na may difficulty siya in transfers kay hindi siya katindog para magkadto to gamit CR. Okay? So actually, no, ginbutang ko lang na da because again, no, perhaps I was overestimating you guys, no, which is an error on my part. So I was hoping man actually, no, nga ma-deduce niyo siya na kung what does it mean for the patient. Okay? Nagadiaper siya, therefore may problem siya sa iya nga activities of daily living. Okay? So amo na, no? So most likely si patient kani nagadiaper lang anay kay hindi siya kapa-CR. But although, no, I accept those things nga base may sphincter control or may incontinence kay in the first place wala ko man gid na state, no. It's hard actually, no, to make a case, but anyways, so whatever the reason is, no, the fact remains that the patient is using a diaper. Therefore, it will indicate sa inyo, it will tell you as a physical therapist that this patient has a problem with an aspect of his ADL, particularly in personal hygiene. Okay, so let's try to edit this problem list. So difficulty when changing diapers again. So you could just say difficulty in changing clothes on the lower E. So turning right and left on the bed. Okay, so excuse me, and sit up. So yeah, this needs some work, mano. So I'm guessing sa diri nga parts ng problem list, you are pertaining to tawag ni. You're pertaining to the difficulty in performing activities in daily living. So let's try and change this a bit, no. So you could say patient has difficulty performing activities of daily living, particularly in changing clothes in his lower extremity, as well as bed mobility in side lying and transfers, such as sitting up on the bed. Okay, so I hope you guys wrote that down. Okay, basi magpitla naman ako. So again, you could use that sort of statement there. And again, no, let's go back to what I said earlier. Try to avoid just jotting down the given data. Make sure you also interpret it. Okay, as a physical therapist, you will be interpreting a lot of data later on. Okay, so I'm not setting super high expectations, early on. But what I'm saying no is that I'm just giving you a heads up later on. Okay. So again, okay lang na magsala kita a bit sa diri nga part. Okay. So turning right and left. So the turning right and left, no. So you could say side lying. The patient has difficulty performing side lying towards the left and side lying towards the right, or side lying towards the left and right. Period. Okay. So So absent light touch sensation on the right hip. I'm sorry. What is end amp?